Finals SAQ20 Wrong-sided peripheral nerve block. A. List the implications for the patient of an inadvertent wrong-sided peripheral nerve block. Implications include potential adverse effects of unnecessary nerve block, such as infection, bleeding, nerve damage, and visceral damage. Bilateral block may be contraindicated, for example, interscalene block. This may lead to cancellation of surgery, suboptimal pain relief, and side effects of the alternative pain relief. Safe doses of LA may be exceeded if correct site is subsequently blocked. Wrong-sided peripheral nerve block may result in wrong-sided surgery. There may be delayed discharge of the patient due to immobility if nerve blocks therefore undertaken on both legs. There is loss of trust and potential litigation. B. Summarize the recommendations of the Stop Before You Block campaign and list factors that have been identified as contributing to the performance of a wrong-sided block. Recommendations of the Stop Before You Block campaign includes education of staff, ensure cooperation of all staff, especially anesthetists, and operating department practitioners (ODPs). After WHO checklist, stop just before needle insertion. ODP and anesthetists to visualize arrow indicating the laterality of surgery. Check the laterality with the patient if the patient is conscious, and the consent form if the patient is not. Confirm site and the site of block. Factors identified as contributing to a wrong-sided block includes long duration since WHO sign-in, patient being turned prone or lateral, busy anesthetic room with a distracted anesthetist, lower limb blocks, as the arrow may not be immediately visible if the patient is covered for warmth or dignity. Anesthetist not regularly performing blocks. C. Define the term never event and list 4 drug-related never events. Never events are serious incidents that are entirely preventable because guidance or safety recommendations providing strong systemic protective barriers are available at a national level and should have been implemented by all healthcare providers. Examples of drug-related never events include misselection of a strong potassium-containing solution, wrong route of administration of medication, overdose of insulin due to abbreviations or incorrect device, overdose of methotrexate for non-cancer treatment, misselection of high-strength midazolam during conscious sedation, and unintentional connection of a patient requiring oxygen to an airflow meter. Additional information. Complete list of never events as defined by the NHS improvement is included here, which includes wrong site surgery, wrong implant or prosthesis, retain foreign object post-operation, misselection of a strong potassium-containing solution, wrong route of administration of medication, overdose of insulin due to abbreviations or incorrect device, overdose of methotrexate for non-cancer treatment, misselection of high-strength midazolam during conscious sedation, failure to install functional collapsible shower or curtain rails, falls from poorly restricted windows, chest or neck entrapment in bed rails, transfusion or transplantation of ABO-incompatible blood components or organs, misplaced nasogastric or orogastric tube, scalding of patients, unintentional connection of a patient requiring oxygen to an airflow meter, and undetected esophageal intubation. Additional information regarding Stop Before You Block. This is a 3-step approach which involves preparation, stop moment, and step 3 is block. Step 1. WHO sign-in is performed on arrival of the patient in the anesthesia room. General anesthesia may or may not be administered. Regardless, the blocker prepares the local anesthetic solution and places the labeled syringe with a suitable nerve block needle in a dedicated tray, which is handed to the assistant out of the blocker's immediate reach. The blocker and assistant should position the patient and equipment in the final position, ready for the block. Proceed with preliminary pre-scan with ultrasound. The blocker dons gloves and prepares the site with cleaning and draping for the block. Where drapes cover the surgical site mark, the assistant should ensure they can later reveal the mark for the stop moment. Ideally, the surgical site mark should always be visible. Step 2 is the stop moment. This is a two-person step that happens only after preparation is complete, and thus immediately prior to needle insertion. When ready, the personnel performing the block formally announces that they have completed all preparations and is ready for the block, uttering, "I have completed my prep. Let's stop before you block." The assistant similarly should reply, "Okay, let's stop before you block." The blocker and the blocker's assistant together should then check the block site by viewing the surgical site mark and verbally confirming the correct site. The assistant reconciles this with the consent form. If the patient is awake and unsedated, they may also confirm the site is correct. Step 3 is performing the block. Only when the correct site is confirmed does the assistant hand the tray to the blocker. The blocker then immediately performs the block. Any delay between handing back the tray and/or performing the block should require the blocker and assistant to restart the stop before you block process at step 1. This restart is to recreate a situation in which the block immediately follows the handing of the tray from the assistant to the blocker. Restart might be at the very start of the preparation stage if the site has become contaminated, or in a later stage, but will always involve first handing the tray back to the assistant.